Rachel Grice is a contributing fitness editor for Livestrong.com and a certified yoga instructor. Previously, she was the science section editor and titling associate for several other sections of Demand Media Studios, including fitness, nutrition, and technology. She completed her undergrad education at the University of Southern California and has worked for Men's Health, FitPregnancy and People magazines. You exercise, eat right and get plenty of sleep, great. But if you're only going to the doctor's office when you think you have a cold or need a refill on your birth control, you're missing out on a huge area of preventative health. Having regular checkups and routine screenings and tests can help you catch health problems and help you avoid a full-blown health crisis years down the road. So to help you take control of your health, here are the tests every woman should have done in her 20s, 30s, 40s, 50s, and 60s. Good health starts in your 20s with a few essential baseline tests. Medical tests women need in their 20s. Many 20-somethings are guilty of blowing off doctor visits and skipping baseline screenings thanks to a combination of other preoccupations, dating, new job, starting motherhood, and, in some cases, less than adequate health insurance. But now is when you want to find a primary care physician you like and trust, says Dr.Simpler, M. D. Primary care practitioner at Mercy Medical Center in Baltimore. Your goal is to set yourself on a healthy course while it's still relatively easy, she says. This includes developing healthful eating habits, getting regular exercise and plenty of sleep. What you do now and how you take care of your body will help prevent health issues that can crop up as you age, such as high blood pressure and diabetes, Dr. Simpler says. Most insurance companies cover routine visits and screenings, so why not take advantage and get familiar with some numbers like your blood pressure and cholesterol level. A thorough physical includes a total blood workup, CBC, which tests for conditions such as anemia, low red blood cell count. You might also get a cholesterol test and/or a fasting glucose test, especially if you are overweight, to check for diabetes and pre-diabetes. Your doc will listen to your heart and lungs, examine your eyes, ears, lymph nodes and abdomen for anything out of the ordinary. He or she will also make note of your age, height, and weight, and ask about your family medical history. According to National Institutes of Health guidelines, you should get an updated Tdap vaccine, tetanus-diphtheria and acellular pertussis, since immunity from childhood vaccines will likely have waned. If you were born after 1980 and never had chickenpox as a child, get that vaccine as well. The MMR vaccine, Measles, mumps and rubella should be updated if you were born after 1956, according to the Centers for Disease Control (CDC) guidelines. And don't forget the HPV, human papilloma virus, vaccine. ALL cases of cervical cancer have now been shown to originate with an HPV infection, says Dr.